Hi, and welcome to Dr. Brainwaves. Today I'm going to discuss depression. Depression is something that I see on a regular basis. Depression is something that probably you see on a regular basis. It's important to recognize so that we can help people to have their best lives. I always tell people that the brain is a part of the body just like any other part, muscles, bones, etc. If you stress your brain out, it will have a response just like another part of the body might. So I give the analogy frequently of if you went and ran a marathon tomorrow, guess what? Your legs, your muscles are going to get sore, tired, swollen, because that's the leg response or that's the muscle response to that stressor. So what happens when your brain gets stressed? Well, brains get stressed from lots of things. Brains get stressed from death, from confrontation, from maybe moving to a new home. Brains get stressed also from physical stressors, so prolonged hospitalization, repetitive or recurrent illnesses, surgeries, etc. Anything that stresses the body out can stress the brain out. So any of those can trigger depression. And I'll throw in there that sometimes people sit there in their minds and they think about their entire life and they can't think of any reason why they're depressed. And that's okay too, because sometimes depression has occurred and we don't have an explanation why, but it's there. So what is depression? Depression is a set of symptoms that occur when the chemicals in the brain shift. And we fix it with things that help to shift the chemicals back to normalcy. So we'll talk about that in a minute. But how to identify depression? Depression is 2 weeks or more duration of symptoms that are overwhelmingly negative. So firstly, there are a lot of negative emotions that are overwhelming at times and distracting and keep you from being able to focus and enjoy people in your life. Negative emotions like anger or irritability, we call it, anxiety, guilt, sadness, the blahs. Those are all negative emotions that people have that interfere with their focus, their energy level. So we'll see weight changes, energy changes, sleep disturbances, poor focus and or function, and lack of interest in things and people and situations that you normally enjoy. So those are all signs of depression, and we can treat that. I tell people often that I remind them that antidepressants are not addictive. We're not talking about Xanax and Valium, etc. We're talking about antidepressants that fix the chemical makeup in the brain and increase our serotonin, which is a well-being hormone in the brain, chemical in the brain, so that we can function better. And it's really important for people to be able to return to being able to function at their workplace, at their home, enjoy people. And I remind women oftentimes, you're trying to work, be a mom, be a wife. And if you have 2 months in a slump, you're going to get behind in your work and it's going to affect you and a lot of other people. So sometimes I can appeal to people to get it treated, not because it's a problem even for them in their mind, but because they know that their depression is slowing them down. And if they get better, then a lot of people around them are going to benefit from that. So you can look for loved ones that have that. Sometimes people are very open to the idea of being depressed and being treated for it. Sometimes they're not. Oftentimes I will counsel people in the office that I might see that they have what we call a flat affect. They're a little disengaged. They're very negative. So if I see that, sometimes if they're not receptive at that moment in time, I describe to them what depression is. And I say, well, think about it. Think about if that's something that you have. Because sometimes they go back home and they kind of look over their life. They look over their interactions with others, their activity level, and they realize, yeah, I do have some. And I tell people, you can muddle your way through it because most people can emerge from depression on their own. Might take 2 months, might take 2 years, might take longer. Or you can take a medicine which will get you to emerge from that. Usually within a few months, we can get you to emerge from that, oftentimes sooner, but I tell people be a little patient. The medications that we use for depression are not replacing the chemical in the brain because we can't do that. It's not chemically stable. We can't stick it in a pill and pop it in our mouth. It's a medicine that helps your brain make more or keep more of the hormones, rather the chemicals in our brain that are giving us that well-being, good attitude, positivity, make us be more high functioning and happier. So how do we start people on these medications? We start them on medications by mouth. They're easy. They don't have a high side effect profile. They don't cause a lot of side effects. And you sometimes tighter people up, or sometimes you start them on a little bit of a higher dose if you feel like they're relatively depressed and you want to get something on board right away. And then you can taper down to a smaller dose. With most anybody that takes an antidepressant, we do warn people for some people, there will be a little increased risk for severe negativity in the form of suicidality, meaning feeling of self-harm. So we recognize that can be a potential side effect of these medications, albeit very, very rarely. So I just make sure I bring people back really soon. I make sure that they understand that I'm a contact to call if they have questions or problems. I have another video where I'm going to talk about a little bit more severe depressive symptoms so that you can maybe differentiate. But I encourage people to take care of themselves, take care of their brain like any other part of the body. And if you have some of those symptoms, bring that to your doctor, bring that to your provider and discuss how these are affecting your ability to function and live your life, and you'd like to have them treated. Or maybe not you, maybe it's somebody you love and you care about. Oftentimes that's how patients come to me. They'll have a loved one that brings them in and says, hey, here's so-and-so, and they are not functioning well. Or they can't seem to get over this life event. And that's legitimate, because we can really help people to feel better and much faster with medication. And it's oftentimes not long-term. Most of the time it's not long-term, and sometimes it is long-term, and that's fine too. We just want people functioning and feeling well. So that's a little overview of depression, and thank you for visiting Dr. Brainwaves.